Addie Wooten is a clinical psychologist who specialises in the area of urology. She holds a PhD doctoral thesis in clinical psychology from the University of Monash, and she works at the Royal Melbourne Hospital in the urology department and specialises in the psychological issues of men with prostate cancer. Dr. Wooten, in your experience, at what time points might a man with prostate cancer have contact with a psychologist?
It can happen at any time point, really. Commonly, I will see people at the point of diagnosis where, as you can expect, the diagnosis of cancer can evoke a whole range of different emotions. And so people will be faced with maybe fear, maybe a bit of anger, maybe a lot of uncertainty about what treatment option to take up. And so I'll see them at that point of diagnosis and also around the time of deciding on which treatment option to choose. So prostate cancer is a very unique cancer in that the doctors will commonly give the patient a number of choices, and so that in itself poses a dilemma for lots of people, and so they spend a lot of time needing to thrash out what's going to work for them. So I spend a lot of time with people around that time, helping them weigh up the pros and cons of different treatment options and talking to them about the emotional impact then. Then I see patients and their partners along the course of recovery. So often I will see people straight after surgery or around the time that they have their radiotherapy, and I follow them over that course of time. So after treatment, there are issues like dealing with sexual dysfunction or dealing with continence comes up, and so we spend a lot of time talking about those issues then.
What does prostate cancer have on a man's partner?
It can have a significant impact on the man's partner. Because of one of the side effects being the sexual dysfunction, what can happen is that the relationship, the intimacy changes within a couple, and so men and their partners are affected by that, obviously. Women can often feel a little bit isolated. Sometimes men withdraw when they feel down or they're worried about their masculinity, and so women will find that they might not have the same experience in their relationship as they did prior to the operation or prior to radiotherapy. And so the impact on the partner can be quite significant. In fact, some research has found that the partner experiences a higher level of distress than the patient themselves. So we know that women really do feel for their partners and they want to support them, and sometimes if their husband is struggling with prostate cancer, they don't know what to do, and so they really do feel quite distressed at some time points. Often I spend a lot of time working with couples in terms of dealing with intimacy, and I get them talking about sex and how they might redefine their relationship in a new way, and hopefully couples can figure that out and they can actually benefit from this change. They can reinvent their relationship and enjoy a good sexual and intimate relationship again.
Link, or do you know of any link between prostate cancer and depression?
Yeah, there is a link, unfortunately. As you know, Movember has raised a lot of awareness each year in November, and they raise a lot of money for depression and prostate cancer, and they've done that together because there is a link between depression and prostate cancer. There seems to be a really core construct that's affected by prostate cancer, and I think that that's probably masculinity or masculine identity. And unfortunately, when identity is affected, depression can creep in, and men often feel unable in some ways to talk about that. So Movember's doing a great job. They're highlighting those issues, but I think we do have to recognise that depression can be there for a lot of men with prostate cancer. And we might look for signs like agitation or irritability, or that loss of motivation or enjoyment in things that they might have enjoyed prior to having prostate cancer. And they might be telltale signs that someone is depressed. So unfortunately there is a link, but there are things that men can do about that, and partners can also play a really key role in helping their partners to...
What can they do?
Well, I think it's important to open the channels of communication. So to ask if you're worried about someone, that if they might be depressed, then to say to them, well, I've noticed that you're a bit different, or you're a bit down, or you're not enjoying golf like you used to, or something like that, and open up that communication and acknowledge that these experiences have no doubt been difficult for both of them to go through, and that we understand that challenges like prostate cancer really do affect people emotionally, and that's okay. It doesn't mean that you're any less of a man. It doesn't mean that you're weak or that you're not coping. It just means that you're going through a difficult time, and we all need a bit of a handout sometimes.
Do you see it commonly in your own practice?
Yeah, I do, but I probably see the pointy end. Being a psychologist, people don't generally come to talk to me about the happy things in their life, so I see the people that are struggling. And I think it really is a part of life. We all go through phases where we face challenges and we have ups and downs, and that's normal. And if we do need a hand, it's really important to reach out and to find someone that you feel comfortable talking to. And there are lots of psychologists all over the country and all over the world that can help in those ways. I'm Addie Wooten. I'm a clinical psychologist and I work from the Australian Centre for Prostate Cancer Research. Commonly after a diagnosis of prostate cancer, a whole range of emotional issues can arise, including changes in relationship or intimacy levels, and even difficulty coping with continence and the associated side effects of prostate cancer treatment. All of these experiences are completely normal, and we see these things happening to people all the time. We know that it is important to reach out and ask for support, and there is a whole range of different support services available. So please don't forget that there is support out there.